So let me go ahead and officially start and welcome everyone to the Dayton VA Medical Center's Integrative Medicine webinar. We're thrilled to have so many participants on this session today. I want to start by letting everybody know, again, this is being recorded, and so if there's something you missed or later want to rewatch, you'll be able to do that. We'll be sending you a link to this recording after the event. You can also share that link with anyone you feel may benefit from the information we are sharing this evening. I'm Scott Leese with the Community Outreach Office at the Medical Center here. I am an Air Force veteran, and like many of you, once had many questions about VA healthcare. Let's see if we can answer your questions this evening. Please realize that as a participant in this session, your microphone has been muted to minimize distractive background noises. We have quite a few participants on the webinar this evening, well over 100, which is why we are keeping everyone muted. Again, this is simply to ensure there isn't an excess and distractive noises. That doesn't mean we don't want to hear from you. If you have a question or a concern, you can share it with the panelists anytime through the chat pane. You should be able to find this pane on the bottom right of your screen. Simply type in your question, and one of the presenters will get to you as soon as they can. For the sake of time, if we don't get to your question during this presentation, you can reach us by phone or email, and we'll provide that contact information at the end of this presentation. Now I'd like to take a few minutes to have our director, Mr. Mark Murdoch, introduce you to our Dayton VA Medical Center.
Hi, I'm Mark Murdoch, Air Force veteran and director of the Dayton VA Medical Center. I'd like to welcome you to the Dayton VA, one of the largest and most historic veteran medical centers in the nation. This campus began as a soldier's home in 1867, providing medical services and rehabilitation to Civil War soldiers. Though the campus has changed over the years, our purpose is not. Just as President Lincoln instructed all those years ago, our mission remains to care for him or her who shall have borne the battle. We do this by putting you, the veteran, at the very center of every decision we make. Whether it's the revitalization of our historic grotto and the healing gardens, the addition of a new MRI suite and simulation center, our community-based outpatient clinics, which were designed from the ground up with our veterans' needs in mind, our complimentary valet parking for our veterans, or the construction of a new Fisher House to give you and your loved ones the ability to rest and recover with all of the comforts of home. Your physical, mental, spiritual, and emotional needs are at the heart of every step that we take. Here at the Dayton VA, we carefully balance our historic significance as one of the first centers for veteran health with the medical needs of the veterans of today and tomorrow. We are proud of our more than 150 years of dedicated service to those who gave us the freedoms we enjoy today, and look forward to spending the next 150 years continuing on the path President Lincoln laid out before us. Thank you for coming to the Dayton VA Medical Center, where we are honored to provide the best possible care to our nation's heroes. You served us, now let us serve you.
Okay, thank you, Mr. Murdoch. While we have a long history of veteran care here in Dayton, this year marks the 75th anniversary of our modern Veterans Administration. We are also very proud of that, and not only are we one of the oldest campuses in the VA, but also boast one of the newest and most modern medical facilities offering top quality care. Not very many people know that the VA is recognized, according to a study done by RAND, as being one of the top medical care systems in the nation. And it's top rated by the vets who it serves with a more than 98% rating, approval rating, satisfaction rating. This is a benefit that not everyone is able to receive. This is only available to veterans. Well, that's one of the reasons why we're here tonight. For those who are not enrolled with VA, we hope that you take an opportunity now to do so. It's very easy. One way is to visit the Dayton VA Medical Center and stop by the Enrollment and Eligibility Office. They will be glad to help you through the process. You may want to call first to schedule an appointment. That number is 937-268 937-268-6511, extension 5336. We'll be sharing that information again later on, but again, the number is 937-268-6511, extension 5336. They will tell you what documents you need to bring to determine your eligibility. For the tech savvy, you may also enroll at www.va.gov. Veterans may also reach the National Call Center to apply by calling 877-222-8387. And finally, veterans may mail an application directly to the Dayton VA Medical Center. You can also enroll in person at the surrounding community-based outpatient clinics, also known as CBOCs. They are located at Lima, Middletown, Richmond, and Springfield. Again, we'll share this information with you later on in the presentation. Now, the reason we're here tonight, let's hear from a few of our professionals who can tell us more about how veterans can receive vital benefits of VA healthcare, specifically integrative medicine. Greg, would you like to share that video, please?
Hello, my name is Dr. Amy Wooten, and I am the Section Chief of Integrative Medicine at the Dayton VA Medical Center. Veterans can be referred to the Integrative Medicine Clinic by their Dayton VA primary care provider. The Integrative Medicine Clinic provides comprehensive pain management treatment for chronic pain. Integrative medicine is a healing-oriented medicine that takes account the whole person, including all aspects of the veteran's lifestyle. It emphasizes the therapeutic relationship between the provider and the patient and makes use of all appropriate therapies. The patient and the provider are partners in the healing process. A whole health approach to care is emphasized at Integrative Medicine. Whole health centers around the needs of the veteran. Integrative medicine staff members help veterans develop a personalized health plan based on their values, needs, and goals. Whole health focuses on self-care, giving veterans skill building and support. Approaches such as stress reduction, yoga, Tai Chi, mindfulness, nutrition, acupuncture, and health coaching are available. Chronic pain management is approached by several different modalities, and multiple treatment paths can be pursued concurrently. We offer traditional pain medication management. A clinical pharmacist is available to help with pain medication safety. An on-site pharmacy is also available at the Dayton VA to pick up your prescriptions. Prescription medications can also be conveniently mailed to your home, and many over-the-counter medications are available to be prescribed from the VA pharmacy. Active treatments and consistent body movements can be one of the most important and sustainable treatment strategies for chronic pain. The best type of body movement for pain treatment uses your energy to move the large muscles in your body. Some activities increase your stamina, while others improve your strength, flexibility, or balance. Moving your body in these ways can improve the veteran's ability to achieve and maintain an active lifestyle with rewarding levels of physical activity. Physical therapy is offered at the Dayton VA main campus, as well as Middletown, Richmond, and Springfield CBOCs. Our therapists can help veterans develop a home exercise plan tailored specifically for their needs. Kinesiotherapy literally means movement therapy and is offered in the fitness center at the Dayton VA. KT uses exercise principles to enhance the strength, endurance, and mobility of individuals with functional limitations or those requiring extended physical conditioning. Therapeutic yoga classes are offered to help treat chronic pain conditions such as back pain, fibromyalgia, neck pain, and arthritis. Each class is led by a certified yoga instructor. Therapeutic group yoga classes are offered weekly for an 8-week session. Yoga can help improve flexibility, strength, and balance. Relaxation techniques are also introduced during the yoga sessions. Tai Chi can help ease chronic pain. Some solid research shows that Tai Chi can benefit people with osteoarthritis, rheumatoid arthritis, fibromyalgia, tension headaches, and other ongoing painful conditions. Weekly group Tai Chi classes are offered at the Dayton VA main campus. Pain is not just a physical sensation. It is related to both the body and the mind. Guided meditation is taught during the Tai Chi sessions. Mindfulness meditation can lead to reduced sensitivity to pain and is another great tool for veterans to help manage their chronic pain.
Hello, my name is Dr. Shelby Farrell. I'm one of 2 board-certified chiropractors at the Dayton VA. Chiropractors offer hands-on adjustments to alleviate pain and improve joint function. Treatments may include manual manipulation, activator method technique, cervical and lumbar decompression traction, roller table, massage chair, ultrasound, as well as heat and ice.
Hello, my name is Michael Gustafson. I'm one of 2 board-certified chiropractors at the Dayton VA that is also certified in acupuncture. Acupuncture is the insertion of very thin needles into very specific points on the body. Acupuncture treatment is provided for pain-related conditions, is typically a painless procedure, and can have a TENS unit applied to increase its effectiveness. Acupuncture can be a great additional tool used to control a variety of painful conditions.
Hello, my name is Julie Lanter and I'm the physician assistant in the Integrative Medicine Clinic. Here we will evaluate pain issues and develop a treatment plan with recommendations that may include therapies, medication, or interventional procedures. Treatment options may include injections, neuromodulation such as spinal cord stimulators or peripheral nerve stimulators, or a pain pump to help manage the pain. Most procedures can be performed here at the Dayton VA Medical Center in the Interventional Radiology Department, while some may require a referral to a community provider. There are many tools available to help manage pain and restore or maintain function, allowing for improved quality of life. As you can see, Dayton VA Medical Center is a one-stop shop for many comprehensive pain management treatment modalities. To see an integrative medicine provider, veterans must be enrolled in the Dayton VA. Consults can be requested by the veteran's primary care provider.
Thank you, Dr. Wooten and crew, for that great presentation. Now we're going to take some time to answer questions we've received through the chat pane. We have a couple already, but I want to remind everyone, if you have a question, please feel free to ask it by typing it into the chat pane. We'll get to it as soon as we can within the time remaining. If we don't get to your question, please know we still want to answer it. We will give you a call the next day or soon afterwards, and we'll give contact information where you can call in with questions also if you don't want to share your questions with everybody on the chat this evening. So we have with us live this evening Dr. Amy Wooten, an MD in pain management. She started at the Dayton VA 4.5 years ago. She joined the pain management team 10 months ago, and she also has 19 years community care experience. Also with us is Dr. Shelby Farrell, a chiropractor. Dr. Farrell has been with the VA for more than 5 years and has more than 20 years community private chiropractic practice experience. And we have Dr. Michael Gustafson, who specializes in chiropractor acupuncture. He joined the VA 8 months ago and has more than 7 years experience as a community solo chiropractic business owner. Julie Lanter is with us, and she is a physician assistant in pain management. She's an expert in spinal cord stimulator and injection therapy and pain pump care. She also has worked in the VA pain clinic for 2.5 years and has more than 20 years experience in community private pain clinics. And finally, we have Dr. Scott Murray, whose specialty is pain management psychiatry. He's been with the VA for 8 years. He also has 16 years experience in community private practice. Again, I am Scott Leese. I am the outreach manager for the Medical Center's Community Outreach Office, and I am an Air Force veteran, and I will help answer any questions you might have about the Dayton VA in general. Now let's see what questions you have. So again, if you have any questions, feel free to type it in the chat or in the Q&A pane. So first up, we have with us Joseph, who wants to know what COVID-19 restrictions are in place at the Dayton VA Medical Center. And I will answer that for you, Joseph. Currently, we are asking everyone to wear a mask. We are in a medical facility where we actually are doing COVID testing. We've got people at high risk, and we want to ensure that we take a priority for everyone's safety. So we ask that you wear a mask when you come to the Dayton VA. If you don't have one, not to worry. We have some at the front desk. We'll be glad to give you one. Now, Chuck wants to know, do I have to have a referral for injection therapy? And who would like to take the answer to that?
I will. Yes, you do have to have a referral for an injection. Sometimes primary care doctors can put an order in to the interventional radiology group to have those injections done. And sometimes the primary care doctors may refer you through the integrative medicine department, and we will evaluate what would be the best injection for you at that time. Sometimes coming up with multiple injections to try in a kind of a sequence of events type of a situation, depending on the outcome of each one.
All right, fantastic. Thank you, Julie. Lance would like to know, can we define pump pain, please? Is there a foreign term to, this is a foreign term to me, so he's looking for a little clarification as to what pump pain is, or pain pumps are.
I can take that one again. A pain pump is an internally implanted reservoir that will deliver a solution that includes the pain medication to the spine canal. It is a computer-based system, and it is able to be programmed with a specific dosing delivered on a continuous basis. These are usually reserved as an end option when all other options have failed and nothing else remains. It is not taken lightly as an option for pain control. That specific treatment is managed by our community providers. We do not have a provider here at the VA to manage pain pumps. You do have to be seen at least once through the integrative medicine clinic to be approved for such a device. And then we forward on the consult to the community care folks if it's appropriate.
All right, again, thank you very much, Julie, for that answer. Robin would like to know, would care also include PTSD or stress relief? What capabilities do we have for care for PTSD? And do we have one of our clinicians that can answer? I think, Amy, you're trying to answer, but
There we go.
let me
Got
unmute
it.
you. There we go.
Got my unmute button. Yes, we do have a comprehensive mental health at the Dayton VA that does offer PTSD treatment, and you can be referred to them from any providers at the VA, and they can help you with that. They offer video appointments and group appointments and individual counseling for those treatments.
All right. Robin, again, wants to know, would that include diabetic nerve problems? Also wants to know what kind of services we offer for that in integrative medicine.
I can take that as well. There's comprehensive treatments for diabetic neuropathy, including medications, acupuncture is another treatment, meditation, relaxation, different types of medications are used as well too for that treatment. But yes, we definitely see patients with diabetic neuropathy.
All right, fantastic. Craig wants to know if we could tell him a little bit more about the weekly Tai Chi classes.
I could take that one as well. Tai Chi is through our kinesiotherapy department, and it is actually to learn how to do the different techniques. So there's an introduction class. It's a weekly class program that goes for 8 weeks. They're 1-hour sessions, and the goal is to teach you how to use the techniques so you can continue to use them at home. They provide educational material once they know you are doing the techniques correctly, and a video that you can go home with and other resources that you can use so you can continue.
It's super. So Jack would like to know, must I wear a mask in the building even though I've been vaccinated? I'll take that that question. Yes. Actually, Jack, currently we're still asking folks for not only our patient safety, but for everyone's safety to wear a mask inside the building when you come. It's only a preventive cautionary measure. So Chris wants to know, I have constant neck pain. I can't even straighten my neck all the way. Do I need surgery or are there other options?
I would have you at least touch base with your primary care doctor. There are several starting points that they can initiate some of the conservative management for you right away. X-rays are probably a good starting place, but perhaps some physical therapy and just getting an assessment of the whole situation. If need be, the primary care will then refer you on to appropriate therapies or even to the integrative medicine clinic.
All right, super. Thanks for that answer. Shelby wants to know, I go to the Cleveland VA and I'm always trying to keep up with my benefits. I thought this was something new. I am enrolled in Move and medications. I rest. I see chiropractor, all from Akron, Cleveland. Are these all the same programs?
And generally, the VA has some of the similar programs. Each site might do and perform them a little different, but yes, we do have the MOVE program here. And some sites may have, like we have the chiropractic and the Tai Chi classes. Other facilities may have other programs, but they are very similar. We all have the focus of the whole health goal in mind.
All right, terrific. Jackie wants to know, does acupuncture hurt? Are there ever adverse side effects from acupuncture?
I can take that one. For the most part, there is no pain with acupuncture. It's rather a painless procedure. Now, I can't say without a shadow of a doubt that you won't have any pain. Sometimes one needle will be a little bit more tender than the rest. Typically, you'll have about 20 needles in you. Typically, there are no adverse reactions to acupuncture. We do everything necessary to sterilize the area that we're doing before we put the needles in you.
Okay, and we have another acupuncture question from Laura. Do you use acupuncture for conditions other than pain? Do you use it for homeopathics?
Typically, we focus mainly on pain patients with the acupuncture at the Dayton VA. There are some other conditions that we may do as well for stress and different conditions. Homeopathy, we do not focus on at the clinic.
Okay, Greg is wondering, wants to know what you might offer for Parkinson's.
I'm assuming you're referring to the movement balance associated with Parkinson's. That we don't have a specific class that's targeted towards that, like the Tai Chi or the yoga, although those would be helpful. They're geared towards just movement and flexibility in general. We do have the physical therapy, but that could help with Parkinson's and the kinesiotherapy treatment, but we do not have any designated Parkinson's classes.
Okay, super. Lance would like to know what natural medicine methods other than meditation have been accepted.
Not quite sure the question on that. I don't know if you're talking about herbal medications. We do not have those on pharmacy, but we do have things like cupping and if that's more alternative that you're talking about. So I'm not quite sure on that question.
Okay, maybe Lance can go ahead and type something else here more specific into the chat pane. We'll get back to him. Larry also asks, do you offer Reiki treatment?
We do not offer Reiki at our clinic.
Okay. Craig would like to know, how do I enroll in the Tai Chi classes?
Any provider at the VA can actually request that. The best way to go is through your primary care provider and just ask them that you're interested in the Tai Chi class, and they can put a referral for you for that.
Okay, super. Alice would like to know, can I bring a service animal with me to the medical center? And I will be glad to answer that question. Yes, service animals are welcome. They need to be identified as a service animal. In other words, have the vest or some kind of documentation, but we are more than happy to allow anyone with a service animal into the building with that animal. Butch is telling us I have a serious pain, or I have serious pains in my back. Other doctors have told me that they can't find anything, that it's all in my head. Is there anything else that can be done? Can the VA help me?
So I would say that we find folks like this from time to time that do come through our clinic. And one of the best results we get for these folks is with our other modalities, things like massage therapy and yoga, acupuncture, and the Tai Chi, any type of these movement exercises. Having another set of eyes, just look at your imaging and see if there's something else that we might be able to identify that could be a pain generator, although it might not be worthy of surgery. So it's not a bad idea just to have a consult just to see what options would fit best with you.
Okay, thank you for that answer. Christine wants to know, does the Dayton VA offer the ear piercing for migraines?
We do not offer the ear piercing, but the acupuncture, we do the points in the ears that will help with migraines. And we also offer battlefield acupuncture as well, which is only performed in the ear.
Okay, we're coming down to the last few questions here, so I'm going to again ask if anyone has a question, please feel free to type it into the chat pane. Would love to hear from you and love to answer your questions. Earl says, my back is always in pain. On bad days, I may have pain shooting up all the way into my legs, and I can't even stand. What can I do about this?
Well, that's a great question. We'd be happy to evaluate you further. The first step would just be to make sure you're enrolled in the VA, be evaluated first by your primary care provider. They actually are pretty competent in doing a very thorough workup. And if they come to asking for more additional information or second opinion, then they will refer you on to.
Okay. Tom wants to know, do I have to have a specific disability rating to see a doctor? I have had prescriptions for pain, would like to see someone to discuss other options. I want to get off the meds if possible.
You do not have to have a specific disability rating to be seen here at the VA. You just have to be a veteran and enrolled in the VA. We see pain not necessarily, doesn't have to be service connected to have a workup and to be treated here at the VA.
Okay, well, I don't see, oh, I do have another couple questions here. Sorry about that. Lance wants to know, what are the rules on mesotherapy and consultations? Massage therapy.
Massage therapy is ordered in one of two types of sessions, and the acute session is frequently used for an acute issue, as the title implies. At that order, you can see the massage therapist twice a week for 6 weeks, hoping for muscle re-education, and the appointments are generally a half an hour in length. Once that is completed, hopefully you will be able to maintain the results with active therapy on your own. We also have a chronic order for massage therapy, and this is 12 visits over 365 days. This helps with maintenance of some conditions for a lot of folks. And those are the two options we have for massage.
All right, terrific. Well, I think we're actually down to our last question, unless somebody else comes in with something. Judy wants some advice on what's the best way to know if I qualify for this care. Well, I think I could probably answer that. First and foremost, I think we need to get you enrolled with the VA and actually have you see a primary care physician and have them determine if we need to get some specialty care for you. Would be glad to help you out with that process. If we didn't get to any of your questions, we'll be glad to get to those later on. Again, feel free to type in any questions here in the pane, and we'll be glad to get to them. If we don't get to your questions or you don't want to share that question with anyone, feel free to give us a call. And here's where you do that. You can call us at 937-268-6511, extension 2035 or 2159. Again, those are extensions 2035 or 2159. Or you can call Eligibility Enrollment Office as well. Their number is 937-268-6511, extension 4105. For questions about how to enroll with the Dayton VA. They've got a great crew there, and they'll be glad to help you any way possible. Again, there are several options for enrolling with the Dayton VA Medical Center. If you are not currently enrolled but would like to enroll with the Dayton VA, here's how you can do it. First is in person. Come to the Dayton VA Medical Center. Go to the eligibility enrollment desk, and they will be glad to help you with the paperwork. Again, I would suggest calling them in advance for an appointment so they can tell you what documentation to bring. Same with our community-based outpatient clinics, and we'll get that information to you again here shortly. Or you can go online to www.va.gov. They'll be glad to, or it's very easy to go ahead and fill out the 1010 and bring it in person after you do that. You can also call the National Health and Eligibility Center at 877-222-8387, or mail in that VA Form 1010 Easy that you can print off of the website. Again, our contacts for the community-based outpatient clinics, we have CBOC at Lima. Their number is 419-22-3300. Middletown, their number is 513-423-8387. The Richmond CBOC is 765-973-6915, and the Springfield CBOC is 937-342-5480. You can go to whatever clinic you're closest to. So you can see their numbers on the screen here. We'll be glad to give you some time to write those down as well. We hope we've answered your questions about integrative medicine this evening and the VA in general. And for those of you who aren't enrolled, I hope that you are ready to enroll. Thanks to our panelists for great information they have shared with us this evening. And thanks again to everyone who attended this event. Have a great rest of your evening. And thanks to all our veterans for their service to a grateful nation.